Welcome to the Biopharma Business Intelligence Unit, where symbolic integrity meets strategic clarity. At BBIU, we go beyond the headlines to decode the structural forces behind global biopharma, AI, and economic realignment. If you value precision, verification, and symbolic depth, this channel is for you. Subscribe now to access our weekly briefings, dossiers, and intelligence reports, and consider joining our institutional tier to unlock early warning systems, custom metrics, and exclusive strategic insight. You're not just listening, you're entering the future of epistemic intelligence. www.biopharmabusinessintelligenceunit.com.
CDC's retreat from universal COVID vaccination, structural implications for public health. Trust Executive Summary. On October 6, 2025, the U.S. Centers for Disease Control and Prevention, CDC, following the vote of its Advisory Committee on Immunization Practices, ACIP, withdrew its universal recommendation for COVID-19 vaccination. Instead, it adopted an individual decision-making framework, shifting the responsibility for vaccination to patient-provider discussions. Simultaneously, ACIP recommended that the varicella V vaccine be given separately from the combined measles-mumps-rubella-varicella MMRV shot in toddlers, citing rare febrile seizure risks. This marks a structural turning point. COVID vaccination is no longer a default national standard but a personalized medical choice. The symbolic and operational weight of this shift extends beyond epidemiology into credibility, insurance coverage, and the architecture of trust in U.S. health governance. Structural findings from universal to individual. Universal recommendations created uniformity, simplifying coverage and logistics. The shift to decision-making fragments the system, exposing vulnerable groups, elderly, immunocompromised, low-literacy patients to uneven protection. Insurance and equity. Many U.S. vaccination programs, including pediatric supply chains, rely on universal recommendations for automatic funding. Removing universality risks bureaucratic delays in reimbursement and regional disparities. MMRV separation as symbolic parallel. The decision to separate varicella mirrors the COVID reversal. Both frame public health not as a collective standard, but as a risk-averse, individualized negotiation. Structurally, this repersonalizes public health, weakening herd immunity principles. Trust architecture under strain. Frequent shifts in CDC policy, universal, risk-based, universal, individualized, erode public trust. A key structural cost is epistemic fatigue. The public perceives inconsistency as unreliability, regardless of underlying evidence. Political remodeling of science. The replacement of 17 ACIP members before the vote signals institutional engineering. Even if evidence supports parts of the decision, MMRV febrile seizures, the political redesign contaminates its credibility. BBIU opinion. The parallel we cannot ignore. On August 23rd, BBIU analyzed the University of Florida's breakthrough on a universal mRNA cancer vaccine, highlighting its promise but also its dangers. The key variable is not the lipid nanoparticle LNP platform, but the sequence of codons encoded by the mRNA. Each new sequence produces a different antigen with potentially new immunological and safety profiles. Translation into humans requires retroviral screening, toxicity safeguards, and rigorous informed consent. That principle, sequence defines risk, is equally applicable outside oncology. Yet when it came to COVID-19, regulators inverted the logic. They treated each update of spike mRNA as a trivial variant of the same product. The very standard of caution applied in cancer was abandoned in public health. COVID, prevention claims, and the flu logic shortcut. The initial claim of COVID vaccination was universal prevention. That claim collapsed under viral mutation. Regulators then invoked the influenza model. Just as flu shots are reformulated annually, so too could mRNA shots be updated for new spike variants. But the analogy is structurally flawed. Influenza vaccines rest on decades of surveillance and outcome data proving population benefit. COVID mRNA updates were authorized without efficacy trials, relying only on antibody titers. This is a regulatory shortcut that bypasses the real variable, the codon sequence, and assumes equivalence where none can be guaranteed. The subject's right to choose here lies the ethical fracture. In oncology, patients are told explicitly, this is experimental. In COVID, citizens were told, this is the same vaccine, updated, even when codons, the essence of the product, had changed. The result, Individuals became involuntary participants in a mass trial without the label or protections of a trial and without the right to decline on informed grounds. For those who experienced adverse events, like intermittent precordial pain after boosters, this gap is not abstract. It is lived evidence of a system that suppressed nuance, denied transparency, and erased the right to informed refusal. CDC's shift, correction, not retreat. The CDC's recent decision to abandon universal recommendations is not a retreat. It is a belated correction forced by the breakdown of trust. Once the prevention claim failed, once the influenza analogy lost coherence, once personal experiences clashed with universalist mandates, universality became indefensible. This is not the end of vaccines. It is the end of pretending that codon modifications are inconsequential. BBIU stance science demands integrity. Every new codon sequence is a new product in essence, deserving disclosure and evaluation. Ethics demands consent. Subjects must have the right to accept or refuse modifications not validated by clinical trials. Policy demands coherence. Regulators cannot apply maximal caution in oncology and minimal caution in population health. The lesson is clear. Consistency across domains is the foundation of trust. Conclusion: from Florida's universal cancer vaccine to CDC's COVID reversal, the same principle emerges. Sequence matters. The platform LNP is constant, but the message, mRNA, changes everything. Until health governance admits this openly, the gap between science, ethics, and policy will continue to widen. BBIU affirms, public trust is not lost because of mRNA technology itself. It is lost because of the way institutions treated codon changes as trivial. Restoring that trust requires aligning cancer caution with COVID transparency. You've reached the end of the open section of this BBIU content. The complete analysis, with full data, structural frameworks, and extended annexes, is available exclusively to our subscribers. At BBIU, we believe the real value lies beyond headlines, in the depth of structural intelligence that helps leaders and organizations see further. If you want access to the complete archive and future reports, join us at BBIU and take part in the next level of analysis.